are, and welcome to what we call the New Hope Fellowship Health Moment. Prior to COVID, we would do this every month, and it's something I haven't done for a long time. But I truly believe that God is concerned about our health. We see it in Genesis when God tells us what to eat and to exercise. We see it in Leviticus, which many Jewish people see as a health document. And when you look at Jesus, Jesus had a healing ministry. Jesus didn't require a copay or a deductible. It was just a moving free clinic. And so this is Men's Health Month. And because I mainly serve as Black men at my pharmacy and Black men at my church, we've got to do a better job of taking care of our health. And the not so good facts: Black men have the worst health than any other group in these United States. We have the lowest life expectancy and the highest death rate compared to men and women of any other racial or ethnic group. And we've just got to work on that. Now, there are a whole lot of reasons: racial discrimination, high rate of incarceration, unemployment, lack of affordable health services, and poor health education. And a lot of that is because we believe those old wives' tales and all these myths we've been told. And then there is the distrust, because for years we've been experimenting with cultural barriers, poverty, the lack of access to health care insurance. It's a sin that in many of these states, especially in the South in the United States, Medicaid expansion is available, but because they don't want us to have it, it hasn't been expanded. And then insufficient medical and social services catering to Black men. Uh, Back to Medicaid, for years before it was expanded, if you were a Black male, unless you were disabled or blind, you did not qualify for Medicaid. And because men don't go, it's probably not even that profitable to focus on men's health care when it comes to primary care. Of course, when we get older, it gets better. And that results in, look, 44% of us are overweight. 37.5 of us are obese or very overweight. We have a higher incidence of diabetes and prostate cancer. And diabetes can lead to so many things. Diabetes can lead to heart attack. Diabetes can lead to kidney failure, dialysis. Uh, Diabetes can lead to blindness. In fact, diabetes is the leading cause of blindness. And then surprisingly, because life has gotten so difficult with us, we even have a high rate of suicide. And when we look at our 10 leading causes of death in Black men, we have heart disease and cancer, unintentional injuries. And, that's because we sometimes have to work on some of the most dangerous jobs. Or sometimes we take risks doing things we shouldn't do. Homicide, that's something that just happens every day, something we got to deal with, something that we've got to address in our community where we hate each other so much that we kill each other. Chronic respiratory disease. Asthma is a terrible thing in Richmond, Virginia, where I practiced pharmacy for many years. But then when you add smoking, that just makes it worse. Kidney disease. And then I had no idea that sepsis was number 9, because I've just recovered from that myself. And with a sepsis, you get a infection. I got a urinary tract infection, and it got in my blood system. And because The blood is our life. It was possible that I hadn't sought treatment when I did. It could have shut down every system in my body. And then high blood pressure, which also leads to stroke, to heart attack, to kidney disease. Those are top 10 things that are killing us. And then when we look at AIDS, Black men have a 1 in 20 lifetime risk of contracting AIDS versus 1 in 132 for white men. And why does that happen? Well, if you're using intravenous drugs and you're sharing your needles, that shares AIDS. Let's just face it, we'll say that we are not homosexual, but we'll get incarcerated and we'll have sex with our wives or our significant others when they come to prison to visit us, but we'll have sex with men while we're in prison. That it made AIDS no longer a white man's disease, but a Black woman's disease. And because we interact with them, it puts us at risk also. So, what must we do? A lot of us gonna go to the doctor, but we need to get regular medical visits at least once a year to check on ourselves, make sure our blood pressure is right, our blood sugar is right. We need to take advantage whenever they have these health fairs and they have these screenings. Take care of that. Then learn your family history. We carry the genes of our ancestors. And so it's just like in my family, it's heart disease there, it's stroke disease there, it's diabetes. And it puts me at risk. So you need to know that when we go to our family reunion and whatnot, talk about what happened to people. Don't give that typical answer, oh, it was such a terrible thing. Yes, it was a terrible thing because they died, but we need to know. And then most importantly, we got to change our lifestyle, what we eat, and then we have to exercise on a regular basis. And the thing about that, medical science and the Bible agrees. If you go to Genesis, it talks about the food we should eat. It talks about working the garden and keeping, in other words, exercise. So in other words, we've got to eat the right thing, and our bodies were made to move. All right. And then we got to learn how to read a food label. When we go into the store, when we purchase something, we got to learn what it means. In other words, if we see sugar, sucrose, or sodium at the very top, that means that's the most in those ingredients. So we need to be staying away from those. We also need to be avoiding those high fructose, which is nothing but sugar on steroids. We got to avoid the hidden salt or sodium found in canned food and in processed food. And then a whole lot of times, nobody goes around eating sugar. But the thing is, sometimes we eat too much bread because when bread breaks down, it breaks into multiple sugars. Sometimes we eat too many potatoes, the same thing. And then we got to avoid that fast food. It is killing too many of us because it's loaded with fat, sugar, sodium. All right. And then we need to know the signs and symptoms of diseases. Just like frequent urination and losing weight can be a sign of diabetes. But then we've also got to realize that diseases like high blood pressure, there are no signs and symptoms. In fact, when you see the signs and symptoms, body damage, organ damage is already happening. And the same thing with prostate cancer, that can live in your body for years. And too many times we're at stage 4. But, we have to go on and get that PSA. We have to go on and get that digital examination and know you're no less a man because of that examination. And then finally, we got to know our risk factors. We're at risk sometimes because of our race. We're at risk sometimes because of our age. We're at risk sometimes because of our sex. We're at risk sometimes because of our family history. And so I thank you for your time. I hope it's helped somebody. I hope some men have listened. I hope some women have listened and they will share this information with their significant others. I plan to do this on a monthly basis. I'm not going to do it during worship anymore because I hope that I can reach more people and help more people. And I want you to encourage your pastors, your spiritual leaders, whatever faith you are, to embrace health ministries. And this is something I've been doing since I graduated from pharmacy school. The first thing I went out and did a presentation on sexually transmitted disease. We call it venereal disease back then. That's how old I am. But this is something I love to do. So this is something we need to do in all our churches, all our faith communities. So thanks for joining for the New Hope Fellowship Health Moment. And I'll be back next month and hopefully every month and many months to come to share the many things we need to know about our life so that we can have this abundant life that Jesus wants us to have.